According to the Federal Bureau of Prisons, as of March 14, 2020, 45.4% of inmates in the federal prison system are incarcerated for drug-related offenses. Sadly, many of these inmates will return due to limited opportunities and treatment awaiting them outside prison walls. Several of my relatives work in the medical field, and I've heard many stories of overdoses, poisonings from additives and laced drugs, and other health complications that arise from substance abuse. These stories, as well as my interest in being an attorney, have led to a substantial amount of research into measures that can assist addicts. Everybody knows someone who currently has issues with substance abuse or has had issues in the past. It can be especially difficult to see someone you love going through health issues and legal troubles as a result of simply wanting to feel better about their current situation. Many of the addicts that have been placed in jail instead of treatment programs are nonviolent offenders who leave prison with more problems than they began with. To begin, I will explain how the current system for handling drug offenders has had little success in rehabilitating them. I will then present potential causes to widespread drug dependency in the United States, and I will conclude by showing alternative solutions to our system of incarcerating addicts instead of rehabilitating them. Many addicts have been convicted of nonviolent charges such as possession or low-level sales and have fallen into a pattern of recidivism and poor health from the chemicals they are dependent on. Individuals with substance use disorders get arrested most commonly for charges such as the sale of drugs or possession. When a person does fall into a pattern of recidivism, it makes it immeasurably harder for them to get sober, pay their fines, and return to a normal life. A study conducted by the Bureau of Justice Statistics revealed that drug offenders were the second most likely group to reoffend. An astonishing 76.9% of drug offenders released in 2005 were rearrested within 5 years, nearly half of those within the first year of release. According to the United States Department of Health and Human Services, 2 million people had an opioid use disorder in 2018. Of those 2 million people, 47,600 died from an opioid overdose. Without programs that provide services for addicts such as the acquisition of clean needles or medications to reverse the effects of an opioid overdose, people that are addicted to drugs will continue to suffer through the difficult process of getting clean virtually on their own. In addition to the substances themselves being harmful, there are often adulterants in drugs such as vitamin C and baking soda, as well as more sinister things such as fentanyl, an opioid 100 times stronger than morphine. Fentanyl is often used as a filler in drugs such as heroin and cocaine and increases the risk for overdose due to its incredible potency. If there was a service for addicts to test the purity and strength of their drugs, we could entirely eliminate the overdose rate and save thousands of lives. I will now elaborate on why people become dependent on drugs in the first place and provide a few common examples. While there is no singular cause to substance use disorders, a few common causes are improper prescription, lack of education, poverty, and chronic pain. One of the common stories among young people who have become addicted to opioids is that they were initially prescribed legal pills such as OxyContin by a physician after an injury or surgery. Before there was stricter regulation of prescription medications, improper or overprescription by physicians was common. In addition to using drugs to manage pain, individuals often use them to deal with stress in their lives. People that work minimum wage or blue-collar jobs are at particularly high risk to use drugs, as they often have little time to do anything other than work and return home. With so many responsibilities and obligations, some individuals feel the need to use pharmaceuticals simply to make their work and their lives more tolerable. The most likely cause of high levels of drug use in the United States is lack of opportunity. The inability for many individuals to move up the economic food chain can lead to extreme issues with pursuing happiness. If it was easier for people to pursue higher education and achieve good careers, they would be less likely to become addicted or dependent on drugs. I will now discuss the alternative systems that have been developed to combat drug issues around the world. A few countries that have adopted non-punitive policies aimed at providing recovery programs, reducing or eliminating the sentences for drug possession, and providing sites where individuals can safely use certain drugs under medical supervision. Decriminalization is a public policy that is quickly being encouraged by international groups such as the World Health Organization, the United Nations, and the National Association for the Advancement of Colored People. In Portugal, its non-punitive policy started as a reaction to an increase in problematic drug use, particularly unsafe injection and its serious impact on public safety and health. In 2001, Portuguese politicians enacted a distinctive form of decriminalization. This new policy eliminated drug criminal penalties for low-level possession, as well as the consumption of all drugs, and reclassified these activities as administrative violations. However, the sale of drugs is still a jailable offense. The policy also included a major expansion of addiction treatment and harm reduction services, including access to clean syringes, methadone maintenance, and other health interventions, as well as the elimination of most barriers to these vital services. As of today, numerous successful efforts to reduce drug penalties in the United States have been enacted. These solutions include reducing felony drug possessions to misdemeanor charges, decriminalizing or legalizing marijuana possession, creating pre-arrest diversion programs such as law enforcement assisted diversion, and enacting 911 Good Samaritan laws, which allow for limited decriminalization of drug use and possession at the scene of an overdose for witnesses who call for emergency medical assistance. While these are all steps in the right direction, there is still much more to be done. As a society, we can change the system of jailing individuals with substance use disorders into a system aimed at making more productive citizens instead of more disenfranchised prisoners. Many of the addicts that have been placed in jail instead of treatment programs are nonviolent drug offenders who leave prison with more problems than they began with. Moreover, these people deserve quality health care to treat their substance use disorders. While it can seem like a confusing answer to the complex issue of substance use disorders, decriminalization of drugs can offer a compassionate, humane system that doesn't require the resources that our current punitive system does. Instead of making people manage sickness on their own, we can eliminate the stigma and policies that prevent addicts from receiving proper treatment and get them the help that they deserve. Thank you.